patients who have ALL, which is acute lymphoblastic leukemia. It's the most common cancer of childhood. Accounts for nearly half of all cancer diagnoses of childhood, and is a big success story for us with about 85% cure rates with our current therapy. So this is a patient. He's a little guy. He was normal white blood cell count number is about 10,000. So I would hope in all of you would have somewhere around 10,000 white blood cells if I looked in your blood. This young man presented with a white blood cell count of 800,000. He was very sick when he was diagnosed, and he has been a bit of a challenge to manage. He had a very early relapse because his leukemia is so aggressive. So these are what normal lymphocytes would look like under the microscope. Compared to the red blood cell that it's next to, you can see that they're just a slightly bigger than those cells. They have nice rounded nuclei, those purple spots, and they're nice and condensed. And their cytoplasm tends to like to rub up against the red blood cells, and you can see that it molds along the shape of the red blood cell. This, on the other hand, are all of these leukemia cells. The first thing you'll notice is that they're huge. These are these huge, enormous cells, and how many of them there are. So compared to looking here, where we had one cell surrounded by a lot of red blood cells, when we look at this slide, we see all of these would have two right next to each other. And there, if I showed you this view on his smear, there would just be chock full of all of these cells. The other thing you notice is that the purple area, the nucleus, is incredibly malformed. And so even looking here, it almost looks like a hand or a claw that's reaching out into the cytoplasm. And we see, this is a little bit subtle and hard to see on the slide, but there's it's a pretty dark, dense purple here, and it's pretty homogeneous throughout. If we look here, we can often see either holes in the nuclei, which are called vacuoles, or sort of darker or lighter areas, which are called nucleoli, which are sort of condensation of the chromosomes. So this is one example, and he really had us fooled here because these cells are so abnormal that we weren't sure what type of leukemia he was going to have. So it took having our pathologist do a lot of testing to determine that. I'm going to compare this with another guy who's about the same age as him, who presented completely differently, but with the same disease. And this young man presented with a significant fatigue, and his white blood cell count wasn't super abnormal, but his hemoglobin, which should be about 13, was 2. And so they actually couldn't make a smear of his cells in the pathology lab because he didn't have enough red blood cells for them to go across the microscope slide. So wow. It was 2 o'clock in the morning, and I was down there with the first year fellow, and we were like, can you just give us something so we can look at these cells under the microscope? We just need to figure out what's going on with this kid. So they were like, well, it's not good, but here, you can try to look at this. And this is what his showed. Again, here's normal over here on the right. And you can see his cells are smaller than the ones that we saw in the previous slide, but they still had these sort of very strange nuclei. And that was our big clue that this little guy also had leukemia. We were pretty convinced with him that it was ALL because they look pretty similar to the normal lymphocytes with just some subtle differences. Everybody good so far? Mm-hmm. Okay. And then the last patient slide I want to show you is somebody with AML, which is my disease of choice. And the reason I focus on AML is that despite incredibly toxic therapy, which somebody has a son who had AML, yep. And so you know how toxic bone marrow transplants and aggressive chemo are. There's only about 50% survival in our kids who have AML. And so there's a lot of work that needs to be done there. So this is a 19-year-old young man who presented actually with severe bruising and bleeding, and had a very high white count as well, and has a monocytic AML. And so these over here are normal monocytes, and they're characterized by sort of these butterfly-shaped nuclei is what the pathologist will call it. To me, it's almost like a horseshoe that you see. They are pretty big cells, but not as big as these leukemia cells of his. And the thing that really strikes me here are these holes or vacuoles that show up throughout the cell. So these are air pockets, or look like air pockets, that during the processing, they're components that have lots of proteins and fats in them, but during the processing, those all get washed away when they make the smear. And so that's why they just look like air pockets here. And again, you see these very strangely shaped nuclei compared to what the normal ones are. they're too rounded and too perfect in some of them because we know that the normal cells are more of a horseshoe or butterfly like nucleus. So one of the big differences between ALL and AML is the duration and type of treatment. So our patients with ALL, the girls are treated for 2.5 years and the boys are treated for 3.5 years. That's because the testes are a sanctuary site for the boys, so they're a higher risk for relapse because of that. So they get an extra year of therapy. But almost all of their therapy, except for the first 6 months, is outpatient. So even the first 6 months, they're in and they're out and they're back and forth. But most of those last 2 years, they can be in school, their hair goes back, they're actually feeling pretty good. Our AML patients are completely different. They get really intensive, aggressive therapy up front and are essentially in the hospital for all of it because they're at such high risk for infections and complications. So we have a lot of work to do in AML. And our work in ALL is to make what's already good therapy less toxic because we know almost half of these kids will have long-term medical complications because of the therapy that we give them.
Yeah.
Can I answer any questions?